The public or healthcare issue that I'm very passionate about is mental health. And the reason why I'm so passionate is because it's affected me personally and the friends around me. Most recently, a close friend of mine in the beginning of the year committed suicide, and I saw its devastating impact that mental health can obviously on him, but also his family and the friends around him. And so I want to talk about this issue and what I could do sort of as a university student. And my response will be mainly about how I can sort of take care of the thing that matter myself individually, and then sort of the people that are right next to me, my friends and family. And I think there's an issue definitely of awareness. A lot of people just don't know that how prevalent mental health illnesses are. The latest report by the Australian Institute of Health and Welfare sort of revealed how big this mental health crisis is. 1 in 2 Australians are estimated to have at least one mental health condition in their lifetime. 50%. I mean, currently we're in the virus pandemic, and before that we sort of had the obesity epidemic, but not a lot of people are talking about the mental health epidemic. And so I think what I can do in this situation is, whenever the opportunity arises, such as an example like here, to talk about mental health and how prevalent it is, because we need this message to be more widely known among society. I think there's also an issue in mental health that I can address, which is the stigma about mental health, about not seeking help. And I've experienced this personally because, especially among my male friends, I'm sure this exists among females as well, but there's a tendency for males to not talk about their feelings, to not be open around each other, and to not be vulnerable, to portray sort of an image of success, and that there's never anything wrong. I alluded earlier to my friend who committed suicide, and he had everything going for him. He was sort of a star basketball player at high school. He landed a graduate job at EY. He was getting amazing university marks. He was involved in youth parliament. His family and his friends, he was very popular. And then when this sort of crisis happened, we were all so shocked and surprised, because we never knew he had these underlying mental health issues, and we constantly lamented over the fact that why didn't he speak up? Why didn't he talk to his friends? And so I sort of learned from that experience of the importance of speaking up, and I try and live by that, so that me and my friends sort of have this healthy practice of speaking out. And then this sort of also lends well to my own experience, where going through that process, I sort of sought out counselling services that were offered via Zoom through my university, and I found it very helpful to have something that was and it sort of removed that stigma. So when I talk about that experience with my friends, I always bring it up, because I want it to be made known that we shouldn't have a stigma about reaching and asking for help. And I think also individually, what I can do in this situation is to be vigilant about how my friends are going and how my family are going. If I notice a mood change, if I notice that they're going through a very stressful time, to just ask how they're going, ask them how they're feeling, and if need be, take time out to hear their frustrations. And if I think it's necessary, then refer them to psychological services when they need professional help. I think another issue of mental health that I can address personally is this idea of practicing healthy habits, because we know from research that these are protective for good mental health. The latest World Health Organization report sort of reveals how, sort of in this age of chronic disease, there are 4 healthy behaviors that we can practice that are protective across a whole range of diseases, including mental health. This means not smoking, not drinking a lot, eating healthily, and getting enough exercise. I also read Matthew Walker's research on sleep and the importance of it in mental health especially. He's also, I was interested to find out that the same genes that regulate mental health illness are the same genes that are implicated in sleep. And so that if we're getting good sleep, this is going to go a long way in protecting and fostering good mental health. I sort of want to be an advocate of healthy habits myself, and that's what I can do. I started getting into exercise and eating healthy from my best friend, who back in year 10, he started going to the gym and started watching his diet really carefully, and I was sort of inspired by that. And so by me living those healthy habits is also obviously good for my own mental health, but also the people around me, so that hopefully that rubs off on them. And also practicing good stress reduction strategies, whether that means regularly going out with friends for dinner, or making sure I practice the guitar every day, practice singing, making sure I read whenever I'm getting a bit stressed, or things like these are good habits to get into for myself and for those around me.